Good afternoon. Good afternoon to all of you here at COP26 in beautiful, rainy Glasgow. And hello to everybody who has joined us online for this event. Welcome. Welcome to this event on financing our global health commons, which is organized by the French Development Agency under the umbrella of the Coalition for Social Investments, a Finance in Common initiative. Thank you very much for our host for welcoming us at the IDFC pavilion today. The objectives of today's event are to discuss the massive challenges posed by climate change and other environmental threats on human health and what this means for investments in public health institutions globally. We will particularly highlight the lessons learned from the COVID-19 pandemic and the need to strengthen the global health commons we must support to strengthen health and social protection systems in anticipation of future shock, including those from climate. We will discuss the investments and partnerships needed to advance an agenda of solution. So this event takes place as an event of the newly established platform, the Coalition for Social Investment, which the French Development Agency is happy to co-lead along with the Council of Europe Development Bank. The coalition was launched at the first Finance in Common Summit and brings together public development banks, international organizations, regional networks, and other partners convinced that investments in adaptative social systems are key to face tomorrow's challenges, particularly climate change. The coalition aims at increasing the quality and the volume of social investments worldwide and advocate for a new mindset to make social investments a central pillar of both the social and climate nexus and post-crisis recovery. So let me now welcome our very distinguished speakers today. We're very lucky to be joined here in Glasgow by Sir Andy Haynes, who is a professor of environmental change and public health at the London School of Hygiene and Tropical Medicine. And I have to say, Andy is really the leader on the climate change and health agenda, having been the chair of the Lancet Commission on Planetary Health and leading multiple lines of work that are taking us forward on this agenda. We will then welcome Dr. Christine Abbey, who is a professor at the Center for Health and the Global Environment at the University of Washington. And she was a member of the countdown exercise of the Lancet on the impact of climate change on health. And she's a renowned expert on the health risk of climate variability and change, notably on understanding the sources of vulnerability and estimating the current and future health risk of climate change and the health co-benefits of mitigation policies. We will then hear from Masoud Hamed from the Center for Global Development, who is a partner of this event. He's the president of the center, and he's also a member of the High Level Independent panel. He was a co-chair commissioned by the G20 to look at what needs to happen to invest in pandemic preparedness and how to finance global common goods for health in our pandemic age. Anne Butcher from the Bruegel Institute in Brussels, who is also supported the high-level panel of the G20, will give us some words about the next steps, or how we're moving on this financing agenda to fund those common goods for global health, and in order to invest in public health institutions that will benefit all of us in the challenging times of environmental threats. She spent most of her career in the European institutions working on various aspects of European integration, and her last position was Director General for Health and Food Safety in the European Commission. This will be then followed by a panel, and I'll come back to you and introduce later all the wonderful discussions we will have for the next panel. But to no avail, let me give the floor to Professor Andy Haynes to give us his introduction about climate change, health in this age of pandemic.
Well, thank you very much, Agnes, for giving me the opportunity to say a few words at the outset. And I'm really delighted that I'm going to be followed by Christie, who's an old friend and a colleague. And I know that she'll fill in the gaps that I'm not able to speak about, because I'm going to have to cover a lot of ground quite briefly. Could I have the first slide, please? So, next. So this slide really illustrates two things, really. One is that human progress has been remarkable over the last 50 years, 100 years or so. On the left, we can see these socio-economic trends, dramatic increases in terms of population, in terms of global GDP, in terms of energy use, and a range of other indicators. And we have seen genuine improvements in human progress. So we've seen reductions or other increases in life expectancy of over 20 years since the middle of the last century. We've seen big reductions in maternal mortality, infectious disease mortality, at least until COVID. So we have seen progress. It's been inequitable. But the problem is that global health, as we've conceptualized it, hasn't taken into account the right side of the slide, which is the Earth system trends. So in other words, the progress that we have seen in health has been based on the unsustainable exploitation of natural systems, and that's shown on the right side of this slide. We're here talking about climate change, but there are many other things happening as well as the accumulation of greenhouse gases. We see acidification of the oceans. We see dramatic loss of tropical forests. We see, of course, dramatic declines in biodiversity. So there are a whole range of different environmental impacts which will have some partially understood effects on human health. And they could, of course, as we are now appreciating, be increasingly catastrophic unless we act very soon. So this kind of paradigm, these kind of data really is now very compelling. And yet the global health community has by and large neglected or overlooked the multiple environmental stresses that are going to impact on our human health and are already impacting on our human health. So, so this slide, a simple slide really, tries to summarize a complex situation. And we know that climate change, just focusing on climate change for the moment, of course, greenhouse gas emissions, as we all know, concentrated in high income and emerging economies. And the impacts, at the moment anyway, are concentrated in low and middle income countries, although, of course, no part of the world is immune to the effects. We know that climate change has an effect through three broad pathways: the direct effects of climate change on heat. Extreme heat stress kills people, prevents them from working, has effects on pregnancy, on birth outcomes, for example. So it has wide-ranging effects, and these are getting progressively worse. Effects of floods, droughts, wildfires, we've seen a lot in the last year or so, also have effects on human health. And then there are the effects that are mediated through natural systems. So as we change the climate, of course, we get changes in the distribution of a range of diseases, infectious diseases, water, foodborne diseases, vector-borne diseases like malaria and dengue. And so there are a range of effects mediated through ecosystems, including, of course, on our food supply. So we're seeing changes in the nutrient quality of crops, as well as in crop yield in many countries. And then finally, the effects mediated through social systems, increasing poverty, migration, and conflict. And so all of these put together represent potentially catastrophic effects on human health in the absence of effective action right now. And yet, by and large, the global health community and the healthcare sector has overlooked these growing and worrying impacts. So how do we need to respond? And there are two broad ways in which we can respond. One is by adaptation, creating more resilient systems which can withstand climate shocks and bounce back better, even better than they were before. There's a range of specific adaptation actions. I don't have time to go into details, but things like early warning systems for heat disasters or diseases, but also developing these climate resilient health systems. And you can see from this slide that in order to do that, we need to tackle climate change, and environmental change needs to be embedded in all the building blocks of health systems, ranging from leadership and governance, workforce, health information systems, of course robust supply chains, delivery of services in a way which can withstand climate shocks, and of course the topic we're addressing today, which is financing. How do we finance healthcare systems that can be resilient, can actually help to withstand climate shocks? But it's also important to realize that there's another set of actions, and that is mitigation. And that's a lot of discussion about cutting emissions here at COP. And yet very little is said about the potential health benefits, the near-term benefits of cutting emissions. That's not part of the main negotiations. Neither is it part of much of the discourse around the provision of affordable and effective health care. And that's because many of these actions involve sectors outside the healthcare sector. And yet they're very important to engage because the healthcare benefits are very large. So providing universal access to clean energy, clean renewable energy, can not just reduce greenhouse gas emissions, but also air pollution, which is responsible for about 7 million deaths, something of that order. In terms of the food sector, we know that about 11 million premature deaths a year are related to dietary risk factors, and diets high in red meat with inadequate fruit and vegetable intakes have high greenhouse gas emissions, so they contribute to about 30% of the greenhouse gas emissions, but they're also killing a lot of people now. And finally, the transportation sector is another example, not just through air pollution, but also physical inactivity. Excessive dependence on the private car contributes to global warming, to greenhouse gas emissions, but also to physical inactivity. So having an economy which is focused on human health and climate change mitigation could dramatically transform the landscape for both health and climate change. We can't forget, however, that the healthcare sector is also an important contributor to all this. Although the healthcare sector is supposed to benefit health, it also has negative effects. It's a significant source of air pollution. When we burn fossil fuels to create energy for our hospitals and clinics, we also contribute to air pollution. So we have to reduce the environmental footprint of the healthcare sector. And this slide shows you where greenhouse gas emissions come from in the National Health Service in England. And what you can see from this slide is it's not just about using renewable energy to power our hospitals and clinics. It's also about addressing supply chains, because many of those emissions are embodied in the supply chain. So when we consume pharmaceuticals, when we use medical equipment, there's a lot of carbon actually embodied in those products that we use in our health systems. So we have to work with our providers to decarbonize our supply chains, and in that way we can decarbonize the system as a whole. And remember, the healthcare system is responsible for about 5% of greenhouse gas emissions on a global scale. In some countries it's nearer 10%. In the US it's getting on for 10% of emissions. So you can't ignore the healthcare sector in moving towards a zero carbon economy. And I could say a lot more about it, but I won't. I'll just finish with a couple of conclusions. So there's also a parallel movement in low-income settings. This is the work of the Aga Khan Foundation, and they are funding net zero but also climate resilient health systems in low middle income countries, particularly of course in the Islamic world. And it's very interesting to see some of the things that they've done. They've built a hospital in Bamyan in Afghanistan using rammed earth, so it's much lower embodied carbon. It's also very energy efficient. It's powered by off-grid solar, which meets more than 50% of its energy needs. They've moved away from using asthma inhalers, which contain powerful greenhouse gases, towards powder inhalers, which is the way we need to go. They've stopped using some of the anesthetic gases, like desflurane, which is a powerful greenhouse gas, so they're using different types of anesthetics. And in their canteens for their healthcare workers, they've moved towards much more sustainable diets with less meat and dairy and more fruit and vegetables. So they're looking at a whole system transformation in lower middle income settings to deliver resilient healthcare at much lower environmental footprints. And finally, let me leave you with the thought that we're talking about financing here, And reforming taxes and subsidies is really important to mitigate climate change, because at the moment we're subsidizing our own destruction, which is an extraordinary thing for a society to do. According to the IMF, the International Monetary Fund, if you take into account the value of all the adverse effects of burning fossil fuels, we're subsidizing them to the tune of nearly $6 trillion, something like that a year, which is kind of an extraordinary thing to do at a time when we need to reflect the full economic costs. And so if we can convert some of those subsidies, some of those are direct subsidies, a lot of them are due to the unpaid adverse costs of burning fossil fuel. But if we can convert some of those into funding for health, then obviously that's a potential, certainly for the direct subsidies, it's a potential source of funding. So we know that efficient fuel pricing would benefit health, generate income, and also, of course, reduce greenhouse gases. And there's very little for funding for climate change action is actually spent on health. So we're also losing out when it comes to the climate funds, like the Green Climate Fund, ODA, spent on climate action. Very little is spent on either health adaptation or mitigation. So I'll stop there and just say that, of course, we're in a very difficult situation right now with regard to climate change and human health. There are big challenges ahead, but we can see that there are some solutions within reach, and we need to refocus our economy on addressing health in the context of sustainability. The Sustainable Development Goals show us that whilst SDG is about universal coverage, you won't achieve better health unless you also address many of these other SDGs like sustainable energy, climate change, sustainable cities, food systems. You won't achieve universal health care and good quality high life expectancy unless you also address these other sectors. Thank you very much.
Thank you very much. Thank you very much, Andy. Thank you, Professor Haynes, and a very, very powerful speech. And I think this point about the fossil fuel subsidies is not only we don't tax fossil fuels, but we actually subsidize it, which makes really the whole fiscal issue around fossil fuels a health issue. Because it is not only an environmental issue, but it is a health issue, and it could be taxing fossil fuels could be seen as equivalent to taxing tobacco, alcohol as a health tax, or sweetened beverages, right?
It could be.
Oh, yeah.
We have to be quite careful with fossil fuel taxes because we don't want to disadvantage the poor.
Yes.
So if you just tax fossil fuels and put in place expensive renewables, which the poor can't afford, then that has negative effects. So how you design your policies is really important. Now, some countries, like Indonesia, for example, have recycled their fossil fuel subsidies into provision of universal health coverage. So it made it much more politically acceptable, as well as beneficial to health, by saying, okay, we are going to take away these subsidies, but we're going to divert the funds that we get into providing affordable health care for you, the people. And that makes it much more acceptable.
So you transform them into subsidies that are even more progressive.
Exactly.
And fossil fuel subsidies are actually rarely progressive, but whenever they are, you can transform them into another
to make
type
them more
of
progressive.
subsidy.
Exactly.
Maybe just one follow-up question is from your perspective as this leader on climate and health, what are the lessons learned of the pandemic? Of the COVID-19 pandemic. Is this our first global call of what's going to happen in the future? What have we learned from this crisis so far?
Well, as you know, and we discussed this quite a lot in our Planetary Health Commission, the multiple environmental changes that we're really imposing on our planet mean that we are going to get more very unpleasant surprises. Emerging diseases are just one example of those, and you know, we may see emerging diseases coming from other sources. For example, melting of the permafrost in the Arctic, as we've already been speaking earlier in this in COP. We've been talking about the potential for novel diseases or bacteria and viruses that have been dormant for millennia could be reactivated. We don't know whether they could have effects on human health. They might have. So there could be some very nasty surprises in store, and you know, hopefully we'll emerge from COVID fairly soon, but even when we do, we need to be on the alert. Now, many of the things we need to do for these emerging diseases and other shocks are exactly the same things as we need to do for climate change. So more resilience in health systems, making sure that our health systems are capable of withstanding these sudden challenges which can emerge quite quickly, as we've seen with COVID. And that requires, obviously, training, building in some kind of redundancy in supply chains, ensuring that they are capable of quickly ramping up the essential supplies when they need to, and building health facilities which are more physically able to withstand, in the case of climate change, it might be floods, it might be droughts, it might be extreme heat. We don't want to just do so by, for example, just using more air conditioning, because, you know, that's expensive and it burns more fossil fuels and so on. So, and also it pumps the air. You've got to pump the air somewhere. You put it out in the open air and increases the urban heat island effect. So there are many lessons that we can learn across these different challenges. But first of all, we need to do is to try to understand them better and to build them into our healthcare planning.
So I really, I retain two main messages from the pandemic coming from you. So one is that we cannot expect the future to be like the past.
Absolutely not.
So the typical way we were doing health planning, which was based on analyzing trends of the past and saying that we need to expect the same kind of trend, we see that in fact there will be disruption, and as you say, there will be nasty surprises.
I'm afraid so.
Yes.
And so some of the old, you know, I remember there was the converging by 2035.
Yes.
There was that, and I thought that probably is not going to happen, because it's not going to converge by 2035. It's probably going to diverge, and there'll be all sorts of shocks and unanticipated things happening on the way. So we've got to avoid using the past as a guide to the future, because the future will be radically different from the past.
And that's a big lesson, because global health has typically
just
used a lot of projections
exactly.
to anticipate what to do in the future based on the past.
Well, if they do that, they should include climate projections.
And then they should integrate climate projections, because as you said, the convergence we were hoping for in a very optimistic way is very likely not to happen. And then there will be surprises, as you said, which means that we also need to build a different health system. Yep. That will be more adaptative,
yep.
That will be more multi-sectoral,
yep.
And that's also a very important, very important point, because we also cannot expand universal health coverage, as you say, on the basis of what we've learned over the past decades.
Absolutely.
But we need to develop a health system that is much more flexible and adaptative.
Absolutely, and we need better surveillance systems so we can pick up new conditions or outbreaks of disease much more quickly. And as you say, we need to engage other sectors, because in many cases they have such an important influence on health. And the average minister of transport or of housing or of food and agriculture doesn't realize that they're actually ministers of health. And we need to break that news to them that, you know, we need to work together with you if we're going to sustain and support health.
Well, that's absolutely wonderful, Andy. Well, so interesting, so fascinating. And in a way, basically telling us that the climate change agenda is the health agenda.
It's a health agenda, and unfortunately it's here to stay.
It's here to stay.
But the magnitude of the threats, the size of the threats, depends on the actions we take over the next few years. You know, we've got maybe a decade to take decisive action. And
the preparedness of pandemic is part of that.
It is part of that, absolutely.
That's one in the same agenda.
But also these other threats as well. Yeah.
Yes. Well, thank you very much. Thank you. We would love to continue this conversation, but I know you have to leave. You are a very busy person, and rightly so. So we would like to continue and invite another a speaker who is terribly knowledgeable on climate and health, Professor Christie Abbey. Are you here? Yes, wonderful.
I am. Thank you, Andy. That was a great presentation. It was great to see you.
Great to have both of you. And Professor Abbey is going to also give us some of her views, building on what Andy just told us on how climate and health are interconnected, and what are the prospects in terms of the most salient future health risk of climate change. So, Christie, up to you.
Thank you, and I'll take my first slide, please. If you could go to the next slide, please. Thank you. As Andy very clearly articulated, there's lots of ways that our changing climate is affecting our health. This slide articulates some of those and also makes the important point, it's not just climate change, it's how climate change is interacting with a broad range of demographic, socioeconomic, environmental, and other factors. So we need to look at how our development choices also are interacting with climate change to negatively or positively affect our health. When you look at these interactions between rising carbon dioxide, rising temperatures, sea level rise, the interactions with these wide range of factors, you can look in environmental health on how our exposure pathways are being affected. The figure shows you the traditional exposure pathways we think about in environmental health and planetary health. Andy talked about some of these. And under each of the exposure pathways is a partial list of the kinds of adverse health outcomes that we are concerned about with a changing climate. These are not all of the possible adverse health outcomes, but as you look across this list, you can see that climate-sensitive health outcomes are across everything that a Ministry of Health has to deal with. Everything from taking a look at what's happening for people who have chronic diseases and are exposed to high ambient temperatures and have heat stress, all the way through to, Andy talked about migration, issues with mental health. So we have an incredibly broad agenda that needs to be addressed. Next slide, please. And when we look into the future, we are looking at a future where both climate change and development will affect the magnitude and pattern of climate-sensitive health outcomes. This is some work on heat-related morbidity and mortality, ozone, malaria, diseases carried by Aedes and Aedes albopictus, Aedes aegypti, Lyme disease, and West Nile fever. The reason these 6 were chosen is these are the 6 climate-sensitive health outcomes where there's sufficient projections, where one can do an assessment along the lines of what's been done in IPCC reports since the 3rd assessment report. Because of the color schemes, these are fondly called the burning embers in the community. And I'll explain one set to understand what each one of these is trying to illustrate. Each set of these is based on published projections. So these are evidence-based. And I'll just use heat-related morbidity and mortality as an example. 0 is pre-industrial temperatures. And so the y-axis are increases in temperatures above pre-industrial. When you look at the 3 embers within a set, I'll talk about the middle one, where the color is white, it means it hasn't been possible scientifically to see that there's been a change, in this case, heat-related morbidity and mortality. Couldn't tell if it was different. Where the color turns to yellow, it means that scientifically, we've been able to see a change in heat-related morbidity and mortality, and we can attribute at least some of that to climate change. So we know climate change is affecting morbidity and mortality. When the color changed to red, it means that the risks are very high. And when the color changed to purple, it's widespread, severe risk with a possible of irreversibility. And so you can see that the middle ember for each one of these shows that as temperature continues to rise, that the risks for health will continue to increase. The reason there's 3 is that we also assess these under the shared socioeconomic pathways. And as you look at each set, the one on the left is a world with very high challenges to adaptation and mitigation. The ember in the middle is for a world that essentially continues to muddle through. We continue to do what we're doing. We do some things well, we make advances in some places, but we don't make advances in all areas. The ember on the right shows a world that's aiming to sustainable development, a world that's trying to achieve the SDGs. And so you can immediately see across these 6 sets of embers that intersection that I mentioned between climate and development. That if the world aims for sustainable development, we're still going to have risks to heat-related morbidity and mortality as temperatures rise, but we can put off the high risks until very high temperatures, and hopefully by that time, will have sufficient mitigation so that we don't reach 3 degrees C above pre-industrial by 2100. So we can put off into the future the possibility of very severe risks. So these are a way that the IPCC has been synthesizing the literature to help visually communicate these intersections between temperature change, sometimes precipitation change, and development. Next slide, please. This is a recent analysis looking at the global distribution of climate change and health studies and showing you what issues were most frequently researched by region and then by options to manage. As Andy mentioned, there's a very wide range of options to manage climate-sensitive health outcomes. A piece of good news from the health sector is that all the concerns about a changing climate are current problems. Dengue is a major problem around the world. Some places have very good dengue control programs. We can learn from those and implement those in other regions. A challenge for all of the climate-sensitive health outcomes is current policies and programs were designed without considering climate change. They all assumed a stable climate. We are not in a stable climate, so there's lots of work that has to be done to be able to modify these. And as you look at the range of options that people are looking at, we're talking today about finance. I'll talk a little bit more about the need for finance. But there's been lots of efforts going into health adaptation. I shouldn't say lots. There's been efforts going into health adaptation. Much of that is focused on countries conducting vulnerability and adaptation assessments to clearly articulate what their urgent immediate needs are, what they have to do. I was recently involved in a project funded by the Asia Development Bank that did that for Cambodia, Laos PDR, and Vietnam. There are other projects being funded under the UNFCCC to help countries with conducting these assessments and using them to design their health component of national adaptation plans, articulating where it's very important for them to start. Very helpfully, there's organizations, particularly the World Health Organization, UNICEF, and others that are providing a platform for countries to use so they can learn from each other as they're conducting these assessments, as they're learning what they can do in terms of implementation. Next slide, please. And when you look at these national adaptation plans for health, a recent survey conducted by the World Health Organization showed that of the 91 countries reporting, about half of them have some kind of climate change strategy or plan in place. That's not where it needs to be. It's a very good start. However, the real challenge is that when you look at the funding under the UNFCCC, only about 0.5% of adaptation funds have gone to health. When you look at how much research is being funded by the medical research councils around the world, it is a similar problem, less than 1%. There's very little research going into this area. And so as countries are identifying the urgent and immediate risks, there often isn't the information that they need on what plans exactly are going to be most effective in a changing climate. You can find plans that work, for example, with controlling undernutrition, but what are you going to do when undernutrition shifts? As crop yields fall, as you see more droughts affecting undernutrition, as the nutritional quality of many of our cereal crops start to fall. So there's a real large research gaps that need to be filled, both in the research and in the implementation, to ensure that as implementation begins, we learn the lessons we need to learn so that we can scale out and we can scale up and protect and promote health to the extent possible. Thank you very much, and I look forward to the discussion.
Thank you very much, Katri. And let me follow up a little bit like I did with Professor Andy Haynes. What do you think has been the most important lesson learned of the COVID-19 pandemic when it comes to the climate and health agenda?
3 issues. Andy touched on these in different ways. The first is how unprepared health systems are for anything outside their current experience. This is true in wealthy countries. It's true in the low and middle income countries. We see how undercapacity in health systems really put people's lives at risk. The second is those of us who work in global health have a deep appreciation for vulnerabilities, for vulnerable populations, for vulnerable regions. And that was laid bare to the general population in ways I don't think they expected. In the US, for example, we know that redlining, a process that was intended to exclude our Black and brown citizens from being able to get mortgages for houses. We knew those regions have fewer trees. We knew that they were hotter. And so just like with COVID, you're seeing the consequences of those are much more significant than people had expected. People hadn't really, in the general public, hadn't really seen this. And the third is we all talk about systems-based approaches. And I would not have imagined that a worldwide pandemic would mean that my father lives in Detroit, that you can drive around Detroit, look at the automobile company parking lots, and they're full of vehicles they can't deliver because they can't get computer chips. So that deep interconnectedness of our world and really how everything is connected to everything else. And that when we think about pandemic preparedness, we need to think beyond what we need to do in health. We need to talk with the economists. We need to talk with the other sectors to make sure that we can look at stress testing these systems so that if another pandemic occurs or another kind of situation occurs, that we have the collaborations, we have the understanding of what would need to be done to ensure food security, for example, to ensure that we can really protect people under these kinds of extreme events.
Thank you very much. Thank you very much. It makes a wonderful actual transition with our next speaker, Mansood Ahmed, the chair of the Center for Global Development, who has been the co-chair of the high-level panel of the G20 on health and finance. And a report has been prepared by the Center for Global Development and the Bruegel Institute looking at this very issue of interconnectedness and the need to invest in what are the commons, what are the core functions that we all need to be adequately funded if humanity has to withstand this crisis and adapt to the new environment of those threats that are posed by the environmental challenges and particularly the climate change. So do we have Mansood joining us by video? Yes, he is.
Thank you. Thank you for giving me this opportunity to participate in this important session. Before I get to summarizing for you the recommendations of the High Level Independent Panel on Pandemic Prevention, Preparedness, and Response, let me make two preliminary points. The first point I want to make is that even as we focus on preparing for the future, we need to recognize that we are nowhere near on top of dealing with the current pandemic. For many countries, 2022 will be another year of struggling to vaccinate their populations, dealing with periodic surges, and we might all have to deal with new variants. So in this context, you might ask, is it really a priority to also be worrying about the future when we have a pandemic on hand now And the reality is, yes, we have to. And for me, the principal reason is that the epidemiologists are very clear. COVID-19 was not a black swan event. The probability of us being hit by another pandemic, at least as bad as COVID-19, is significant and rising. And we simply cannot afford to be struck by another event like this and be as unprepared as we were for COVID-19. The second point I want to make is that I will talk to you about the High Level Independent panel that was sponsored by the G20, but there were a number of panels that were set up last year. And even though there are second order differences in the specific recommendations that they make, the broad findings of all expert groups and their recommendations are all along the same lines. So we need to focus on the broad recommendations and not get caught up in parsing the second order differences. What are these recommendations? For us, the first point is that the world as a whole needs to spend substantially more for pandemic prevention and preparedness than we currently do. We estimate that at a minimum, we need to spend globally $15 billion a year more in international assistance and financing. Some of this can go through the budgets of existing organizations that are involved in the global health and the global health financing area, but 2/3 of it, $10 billion a year, needs to go through a dedicated new mechanism that will fill the gaps that cannot be filled through the budgets of existing organizations, and do so in an agile way, because these gaps will continue to evolve and change over time. Second, the IFIs, the international financial institutions and development banks in particular, need to scale up their focus on pandemic prevention and preparedness, and do this in a much more systematic way than simply doing it in those countries which ask for this kind of help, alongside a plethora of other activities that they are doing. This is part of a broader effort to ensure that the IFIs continue to be relevant in the 21st century by focusing more on global public goods, of which pandemic preparedness and prevention is one key focus. Climate obviously is the other focus, and you are now at a meeting which brings the two dimensions together. Third, the governance of global health security needs to be not simply an issue to be dealt with by health ministers and health officials, but it has to bring in finance ministries and finance officials. It has to be a whole of government approach, because global health security is strategic in nature. And therefore, it requires the participation, engagement, and ownership of not simply the health ministers, who play a central role, but also of their colleagues from finance. This will ensure that financing for global health security, for pandemic prevention and preparedness, continues to be made available and allocated over time as needed, and does not get shifted out when priorities for other areas become more pressing. If we do that, we end up paying a very high price, as we have just learned, to our cost. This is not about displacing or reducing the importance of the existing mechanisms for global health governance. The World Health Organization, the Global Health Assembly have the central role in this. This is complementing that role by bringing in their colleagues who bring in a finance perspective. Now, as I said, these recommendations have been made. They have been reviewed by the G20 ministers and leaders. They've now set up a task force bringing together health and finance officials to come back to the G20 early next year with specific proposals on the governance ideas as well as on the financing mechanisms. My final plea to you is that the window for taking non-incremental decisions to improve our capacity to deal with the next pandemic, that window is going to close soon. Because with every month that we postpone or delay a decision, we also significantly reduce the probability that difficult decisions will be taken. We need to seize the next few months to make the kinds of non-incremental changes that are needed in the governance and in the financing of pandemic prevention, preparedness, and response to ensure that we are in a better place when the next pandemic comes around. And we should be under no delusion that that pandemic will come around at some point sooner than we anticipate. So I hope you have a constructive and fruitful discussion. I'm looking forward to participating and listening to the discussions that follow. Thank you.
Thank you very much. Thank you very much, Masoud Ahmed, President of the Center for Global Development and co-chair of the high-level panel to the G20. A very powerful message. It is urgent to act. We have a window now to make a difference and start making those critical investments that will get us as a global community better prepared to anticipate the next crisis, the next set of global health risks. And many of them, as was highlighted by Professor Andy Haynes and Professor Cathy Abbey, are just looming. So this is just the first global warning of a lot of unexpected events that might be at the corner. And adaptation is knocking at our door. So let me move to one of the co-authors of this report, supporting the high-level panel, Anne Busher, the senior fellow at the Bruegel Institute. So, Anne, what options lie ahead for policymakers to strengthen global health, pandemic preparedness, and investments in health systems that will be more adaptative, more resilient, and able to handle the new threats that are at the corner looming from climate change?
Thanks, and yes, and first of all, I'm very pleased to speak after Masoud, and let me explain a bit some complementary remarks on the follow-up to the high-level panel report. I think we have this sense of urgency because we are a bit like with climate in this conundrum where we have a global consensus on where we stand with global health security, but at the same time, we fail to take collective action. And Masoud has highlighted this point that we didn't have only one report feeding the debate, the discussion on pandemic preparedness and prevention. We had three in the last 6 months. We had the IPPR, and we also had the Monti report of the Health and Sustainable Development Commission. And these three reports, they all converge in their assessment of the state of play. I mean, they all say, like Masoud has said, that COVID-19 is not a black swan event and is really linked to worrying trends in zoonotic diseases which stem from climate change and losses of biodiversity. They all say that there's a need to act at all levels, global and national, that there's a need to strengthen surveillance, to have a One Health approach, to strengthen health systems, and also to consolidate global supply of vaccines, therapeutics, and diagnostics. And all these reports consider that the response to the COVID-19 has been inadequate. And this reflects to some extent the lack of governance, the lack of coordination in a very fragmented landscape for global health security with different organizations, with overlapping mandates and with limited resources. The other point which has been made by previous speakers, which is part of this consensus, is that most of the countries have neglected pandemic prevention and preparedness, and they have underfunded this. And this is true at national level, and this is particularly true also at global level, with a very weak commitment to global commons. And that starts with WHO resources. Also, all these reports call for a reform in governance and highlight the need for increased funding to these various streams of needs. And what they say is that you don't need a new institution. What you need is a coordination layer, which makes the whole system work as a system and takes into account all the interdependencies. And we know, I mean, on these reports, the discussions at the global level have started. I mean, we have had the G7 summit in June, we had the UN General Assembly in September, we had the G20 meeting last week, and now we had the World Health Assembly in November. And the general feeling is that the progress is very slow, that there's a difficulty to act on recommendations, and that we have the risk of further collective action. I mean, Masoud has mentioned the inability of the global community to finance vaccine as one of the appalling proofs. What we see in the discussions is that there are quite a lot of hesitations on governance and funding models. You have one report, the IPPR report, which is proposing a UN-based system, which is seen as more legitimate, more inclusive, more able to secure global commitments and impose obligations on pandemic and prevention preparedness. And there is, the HLIP and also the Monti report, or more worried about, they want a quick fix, they want a more agile ad hoc setup, and they have pleaded for a G20 plus structure where health and finance ministers would work together, and that would put all the large countries and the financial powers around the same table, and the G20 has a track record of having taken the word out of the financial crisis. So right now there's a clear discussion on who has the convening power for global health, to put all global health security actors together and to coordinate. And this is linked to the question of the funding, because we have identified gaps in various places throughout the chain, at the global level and at national level in low and middle income countries. The high-level panel has talked of a fund of fund. They propose to have that fund hosted in the IFIs, because the IFIs in our international order have been set up to mobilize resources and to channel funds globally through different sectors and countries. Alternatives would be to streamline funding through the existing global health security organizations. There has been also, the IPPR is also proposing a separate fund. There's a whole, the question is really where is the center of gravity for funding coordination? We know that getting an international agreement will take time. There is an urgency not to delay the reform on pandemic prevention and preparedness. And so we have to identify early in the process a coalition of willing and political levels, and I really hope that today's discussion will help. Thank you, Ines.
Thank you, Anne. Thank you very much. And indeed, one of the messages of this session is really to say that IFIs stand ready, whether we're talking about the multilateral IFIs or the coalition of public development bank like the Finance in Common coalition and the Coalition for Social Investments. But whichever way, financiers stand ready to help with the necessary instrument to fund these gaps that you have identified, that the high-level panel has identified. As you said, there's now several independent panels and commissions that have identified that there is a need to fund those global commons for health and at the nexus of health and environment, which is what pandemic preparedness is about. And they need to we need to shift our global health funding to ensure that the global health commons are funded. Professor Haynes and Abbey said it very well. It's like the health issues of tomorrow will be very different. And they will be unexpected, and they will be some bad surprises. So we need to invest now. There is really this urgency. So talking about these gaps and how to go about it, we'll move to the last section of our session, which is this wonderful panel that we were able to bring together. We have a panel of 4 people. We first have the WHO. We have Dr. Susan Sparks, who is a health economist in the health financing team at the World Health Organization. And she focuses on implications of macro fiscal shifts on health financing priorities and incorporating political economic analysis into health financing reform processes. And she will tell us what are those gaps and what needs to be funded. We will then be joined, we are joined by Mrs. Uti Kuisvadniemi, who is currently the Director for International Affairs at the Ministry of Social Affairs and Health in Finland. And she's a senior expert in global governance and financing with a particular focus on global health and EU health and social policies. And she will tell us her vision from a country very affected by climate change, which is Finland, but also from an EU member, and what are the currently concrete initiatives to improving global health security and capacity building for country preparedness that she herself has supported. And she's been a member of numerous groups who've been working on this. And we are also joined by Dr. Tolbert Nyenswa, who is a senior research associate at the Johns Hopkins Bloomberg School of Public Health. And he focuses on public health emergency preparedness, but mostly we are happy to have him here because he was Deputy Minister of Health for Disease Surveillance and Epidemic Control in Liberia during the 2014-2016 Ebola crisis, and he spearheaded the country response there. And finally, as part of the panel, we're really lucky to have Ajay Shah, who is currently part of the ex-KDR Forum and Jindal Global University. And prior to this, Ajay held a number of senior positions in his home country, India, namely at the Center for Monitoring Indian Economy, the Indira Gandhi Institute for Development Research, and Department of Economic Affairs at the Ministry of Finance, and the National Institute for Public Finance Policy. And he will tell us what are, in his view, the implications of the pandemic on future investments at the nexus of health and climate in India. So let me start with Susan Sparks, with Dr. Sparks, and I think what we need to hear from you, Susan, is really what is the WHO telling us about what needs to be financed? What were those gaps that were exposed by first the Ebola epidemic and then now the COVID-19 pandemic? What is it that we need to invest in terms of global commons for health?
Okay, thanks, Agnès. I think I have some slides that should be coming up, but I want to thank all of the previous speakers because I'm reflecting on this program of work that actually started under Agnès' leadership when she was at WHO on this financing common goods for health, and reflecting on the discussions that we had when this work started in 2018. that many of the themes that have been brought up here in terms of underfinancing, underfunding, a lack of collective action, this issue of differentiating between levels at which action needs to be taken between the global and the national, but also really the interconnections between the various emerging health threats. And so whether it's neglected or whether it's non-communicable diseases or pandemic preparedness or environmental degradation. And really that's where this agenda grew out of. And so we can go to the next slide. And so what this group has really done is, I think, back one more, please. Thank you. So this work on financing common goods for health was actually launched in 2019 as part of the high-level meeting on universal health coverage. And so this is an excerpt from the introduction to the special issue that was published on this topic, of which many of the speakers here were involved with. But it was really driven by a concern about clear blind spots in terms of the global and national agendas and investments. And so just at the bottom here, it says these blind spots about the effectively being able to respond to pandemics, but then also the concern about the environmental degradation and climate change and the lack of action. And so I think what we're all hoping for is that, of course, this was September 2019. And then very soon after COVID hit. And so I think what we're all hoping is how can these failures, so these blind spots that weren't so blind after all, which many people were writing and discussing, how can those actions really be taken in relation to the environment and climate change agenda as we tackle this response to COVID-19, that these are not separate agendas, I think, as many people have said, and how do we bring these together into a common discourse around financing, but also around governance and public action. So next slide, please. So a quick technocratic slide on the definition of what are these common goods for health, and how did the technical expert group that we had convened with policymakers, many experts, academics, really convened around this issue around these population-based functions. And when we say population-based functions, these are not services that are delivered to an individual. Rather, these really are societal-based, whether it's global, national, subnational level actions. And in trying to think through, well, what are these actions that have externalities? And so in turn, when you make an investment in a certain common good for health, those benefits accrue beyond the individual. They really accrue to the society at large. And so these are what we would classically call as economists public goods, but they also are other goods that have large social externalities. And as we went through this process of really trying to delineate what are these, how can these be communicated in terms of an actual budgetary dialogue? And I think that's where we're trying to move this is, I think a lot of the discussion has been talking about the threats and the need for action. And this is trying to bring this agenda one step closer to, well, what needs to go into those policies and plans and budgets? How can that dialogue be shaped around those issues? And they really fall into 5 categories. And so the first relates to policy and coordination. So in this context, this would be, for instance, policies around climate resilient health facilities. And then the second are the taxes and the subsidies, which is clearly very important in terms of the environmental agenda related to carbon taxes and some of the other taxation issues that have been raised already. And then the regulation and legislation side of this. And so how can action be taken related to air quality standards, water quality standards, and then the information analysis and communication. And so these are the surveillance systems, whether it's at the global or the national level, and whether they relate to communicable diseases or environmental health related issues. How can we move away from kind of disease by disease focused information communication systems to really going towards a more system-based approach? And then lastly, the population services related to waste management, and which we know are so important in terms of environmental health, but also overall health. And really trying to delineate what we've been trying to do at WHO is really to delineate the dialogue around where do some of these functions actually need to sit at the global, regional, national, subnational level. And then similar to what colleagues were saying about what's coming out of all of the commissions is how can the actual form of financing follow the function that's needed? Where should these functions realistically sit both from an effectiveness standpoint, but also an efficiency standpoint. And that's going to have key implications in terms of the actual pooled funding mechanisms and where that money actually sits, not just where it comes from. So the next slide, please. So this is just a schematic that shows where these common goods for health, how we view them as really foundational for many of the common agendas that we're all working towards, and trying to move away from whether it's either health system versus non-health system or specific diseases, to thinking about what are these common foundational platforms that are really needed to respond both to the current threats, but how can we build these systems, and how can we foster dialogue around the emerging threats and that flexibility that's needed, that we've seen in terms of the negative externalities of COVID, that we've seen on other diseases and health conditions, and how do we move towards that more future forward-looking approach to investments. So the next slide, please. So we know that common goods for health have been underinvested in. And I think that what I find interesting is a lot of the discussion comes back to the financing agenda. And in this work, we know that the market failures, so the action by private sector, that's built into the definition of common goods for health. But what we know is that there's also critical governance and political failures, and that many of the incentives that are built into these political systems work against the investments that are needed, both related to pandemic preparedness, but also to environmental degradation. And often these are the leading issues. And so how can we tackle the real action that's needed, not just on the funding and the kind of discussions around the need for more money, but the real need for leadership and action, and how can these be overcome? So the next slide. So what we know is, and so fast forwarding and trying to take the dialogue that we really tried to kick off in 2019 to where we are right now, is what we know is that COVID-19 has relaxed a lot of the political constraints. So the salience, what we know in terms of how we view these issues, the surveillance systems, I think the public awareness is very different. And so how can we make sure, as many colleagues are saying, to take advantage of these windows of opportunity and capitalize and move towards these more system-based approaches that foster the common identity, whether it's at the subnational, national, or global level, and really enabling the community engagement. So not just considering and doing the research around the environmental common goods for health, the key factor actually wasn't necessarily funding, it was actually related to governance and to leadership and to the responsiveness of political leaders to the demands coming from the communities and individuals. And so how do we foster really a dialogue around both sides? So I'm really looking forward to hearing the rest of the discussions and continuing this work and on financing common goods for health and how it can support many of the agendas that are being discussed here. Thanks.
Thanks, Susan. Thanks. Very clear. So we know what needs to happen. We know which functions are deficient and where are the gaps. We even know the cost. The high-level panel to the G20 has identified as investments needed to the tune of 15 billion per year. So, Uti, so from the perspective of the government of Finland, so what needs to happen now, and what is happening at national level, at regional level with the EU, but also at global level?
Thank you, Agnes, and happy to be part of this panel discussion. It's a continuation of many previous discussions we've had before. First of all, I would like to begin with restating that the government of Finland is committed to ensuring that Finland is carbon neutral by 2035 and carbon negative soon after that. Also, the Finnish constitution includes an article on the responsibility for the environment, including the right for everyone to a healthy environment and to the possibility to influence the decisions that concern their own living environment. So there is a real significant commitment from the government of Finland. We aim to make sure that all measures to fight the climate change are fair also from a social perspective. The transition must be just and inclusive by its very nature, and it needs to be fair to all population groups. If we compare the climate change with the pandemic, we can see many similarities. The COVID pandemic has contributed to significant disparities in wealth and income equality, underinvestment in health and social protection, and in unequal opportunities. In Finland, the approach has been protecting at the same time both the vulnerable people and the functioning of the society and the economy. And I can say that this has proven to be quite successful approach. We have taken steps now to rethink our policies from a systemic approach. The question is how to make societies better prepared for future crises and hazards from an all hazards perspective. This means that we need to invest in research, health and well-being in terms of systemic addressing population needs. These investments contribute to global public goods for health and well-being. They're also important for societal resilience and democracy. Preparedness to all hazards as a common good is not a new idea, but the pandemic has pointed to some of the critical challenges, such as equitable access to countermeasures that we must address in order to be better prepared for future crises. Parallels between financing climate action and global health security include the need to incentivize preparedness so that the impacts do not occur. Investment in core public health functions, health systems, and multi-sectoral preparedness are critical. We understand that preparedness must be built during normal times and be based on regular systems and processes. And this is the same approach for climate resilience. Significant co-benefits can result from actions on climate and public health. For example, developing more sustainable food production or addressing the determinants of health through promoting of plant-based food consumption or walking and cycling as a method of transportation. Enhancing food security can help address the growing burden of non-communicable diseases. Taking the One Health approach, we must recognize the linkage between the health of humans, ecosystems, and animals towards a planetary health systemic approach. Finland has a long experience in this regard, and we really are basing it on a cross-sectoral, whole of government and whole society approach. Finland is promoting the economy of well-being approach. This is a commitment to a healthy planet, people, and economy. And we focus on the links between health and well-being, the economy, and the SDGs to make sure that we're making sustainable solutions for complex problems and look at health, social protection, employment, education, and equality in the same complex approach. When it comes to the regional approach, the EU has made significant decisions in the past year. 2 years ago, we were discussing the possible winding down of the EU health program. Now, with the pandemic, health and health security have become top priorities for leaders. And with the new multi-annual financial framework, the EU for Health program for 2021-2027 has a 5.3 billion euro budget. This is really significant. The aim is to improve and foster health in the EU, protect people from serious cross-border health threats, improve medical products, devices, and crisis-relevant products, and strengthen health systems. We are also setting up a European Health Emergency Preparedness and Response Authority, which will have a 6 billion euro budget for 2022 and 2027, and which will focus both on preparedness and crisis response. From the preparedness perspective, its duties are threat assessments, supporting research and innovation for new medical countermeasures, rapid data sharing platforms, and addressing market challenges and supply chain bottlenecks. In the crisis response mode, it operates on the emergency response and funding, procurement of medical countermeasures, maintaining warm production capacity for vaccines and medicines. There are also several other EU programs to support EU health systems and resilience with a total of 24 billion euro investment. So this is a big change that we've seen in the last year or so.
Thank you.
There's also substantial additional EU funding for climate-related measures in the multi-annual financial framework and the recovery instrument.
Thanks, thanks, Uti. The time is flying, so yeah. I don't know if you could say the your last point, and then I'll move to the next panelist.
Yes, just to mention that there is also a proposal for a new social climate fund in this package.
No, that is incredible. I mean, this is where we see what Susan was saying, that in crisis there is opportunity. This is salience. This is what triggers and activates collective action. We now have 15 minutes left, and I would like now to invite two other panelists, Tolbert and Ajay Shah, to give us the final conclusion from the country perspective of Liberia and India. Tolbert? I think your mic is not open.
Okay, sorry. I said thank you very much for having me, Agnes, for the great session and this special event at COP26. And basically what I will attempt to do in the short period of time we have is to really hammer down on the interconnectedness of the rest of the world, whether you are a high-income country or you are low-income country, to prove that disease have no borders. A country somewhere down in the very remotest part of our world can have a very good impact on what's happening in major high-income countries' capitals. And I have some slides that you could put on. Thank you. Let's move to slide number 1. I have heard this over and over again, dealing with the Ebola crisis in Liberia as the incident manager for 2014-2016 Ebola crisis, that look, never again that the world should face such a calamity with the Ebola crisis that we had, with 11,000 deaths in West Africa, Guinea, Liberia, and Sierra Leone, the high-hit country when I was leading that unprecedented outbreak in the history of the disease since 40 years ago that Ebola was first struck in East Africa in 1976. And from all of the reports, the high-level panels, United Nations report, the WHO's report, we heard that never again this should happen. But then I sit back 5 years later in 2020 to see that we're talking about 251 million cases of coronavirus disease, and also talking about 5 million deaths from the disease. Then I ask myself, what is really going on in the world? But we see that investment in preparedness and response is key. We've seen it after our outbreak in Liberia, the efforts we put in, $60 billion or over was spent with Ebola. If you see the trend from disease outbreaks and what the world has spent from 2001 to 2014, 2016, you will see that. So why should government, next slide please, why should governments invest into common goods for health? Susan was very clear on the categories of investment and places to invest in common goods for health. The economic and social value of health emergency disaster management is large, but the cost to respond is actually, if you compare it, it is affordable. You know, government financing and actions are needed, and market stability to play a critical role in emergency disaster management. Now, institution option for implementing health disaster is very, very much feasible. We've seen at least $4 per capita per person in the world that you can spend on investing in common goods for health. And these can strengthen community health systems when you invest into that. I will give you my last slide to show you how it is important to do that. Sorry, the second to the last one. We move down to the slides that have to do with Liberia's experience on building resiliency after the 2014-26. Next slide, please. After the 2014 and 2016 Ebola epidemics, we invested in healthcare workers, those that are responsible for taking care of emergency operation centers, emergency preparedness and response, field epidemiologists, and all of that. We re-engineered the healthcare system because we knew that when a pandemic strikes, you need to treat people and put them into facilities. So emergency risk preparedness and response, building a resilient healthcare system that can withstand the shock. So when I look back and see countries that have done very, very well, though the statistics is not, the data is not conclusive, you note that countries with emergency operation centers, countries with port health services, countries that have health systems that are re-engineered in emergency management, setting up incident management systems very, very quickly, moving medical supplies and quality of healthcare services, information, and key, engaging the communities. I've seen during this outbreak, North, East, West, Central, globally, I've seen a lot of countries that have experience, that have learned. Even the developed world with lower income, they still struggle with mobilizing the community to have vaccines and all of the misinformation and disinformation. But in the health sector, we have the building blocks that WHO have talked about over and over again, but the building blocks have their own gaps. So common goods of health that have the convergence of things that happen outside of the health sector, for example, education, water, sanitation and hygiene, nutrition, mental health, maternal and child health, housing. All of these things are the convergence that the common goods for health can support, and then we can have a better way of investing in our healthcare system. Thank you for having me. I'm happy to take questions.
That's wonderful, Talbot. Ajay Shah, so what is the experience in India with these issues of investments in common goods for health, whether it is for pandemic preparedness now or for climate change with a longer time frame? Your mic.
Thanks, Agnes. I'm very happy to be here. Here are my quick thoughts. The pandemic was very hard for us in India. The healthcare system was weak, so it was particularly important to do prevention and not cure. And in the work on prevention, the institutional apparatus of public health was also weak. And so, in a sense, the great Indian question of health policy is how to shift focus from what policymakers are primarily doing today, which is they are being the managers of a small public sector healthcare system, and shift prioritization to the common goods of health. And this is really the most important question in health policy in India today. So for example, in the pandemic, we rediscovered that the basic foundations like measurement of disease and the measurement of death was not being done very effectively by the health statistical system, and the only useful information was being extracted by independent researchers using sample surveys, because there was no other way to obtain sound numbers for how many people have COVID-19 and how many people have died of COVID-19. And this is a reminder of the importance of those foundational things that should be there in every country in the health system. To generalize to the question of climate, I think everybody faces the same climate threat, but countries with weak institutions have a bigger challenge. So in a place like India, global common goods are particularly important. I think of it a bit like prevention versus cure. It is much, much better for a country like India that we are able to address global warming at the root cause rather than deal with the consequences of climate change and global warming, which will be very unpleasant given the weak institutions that we have in India. My last thought and comment for everybody in this important meeting is that it is very important for us as the international community to organize ourselves to do better on the global commons, on the global public goods that matter to the whole world. But the implementation mechanism that we are thinking of needs to vary greatly depending on local conditions of governance. So the machinery that you see in Taiwan or South Korea is not there in many other countries. There is a lot of what my friend Land Pritchett calls isomorphic mimicry. There's something that calls itself a central bank. There's something that calls itself a court, but it really has very little of those capabilities. So I think we have to think deeply about state capacity constraints and find ways to engage with subnational governments, with private persons, to vary the engagement strategy by country rather than thinking that most countries have something where the external protein surface is sort of like a state. Thank you.
Thank you very much, AJ, and thank you to the panel and for these reflections. In conclusion, as we're reaching the end of the session, what I really hear throughout this session is that what COVID-19 has shown us is that the pandemic preparedness agenda and the climate change agenda, when it comes to investments in health institutions, is one and the same. It is about investments in public health institutions at country level that serves the commons, that address the market failures, the global market failures that affect both the necessary actions that need to be happening in the area of climate change as well and the area of health security. And I really want to close this event with a quote from our CEO, from the French Agency for Development, Rémi Rioux, who is also the chairman of the IDFC. And you know, the IDFC celebrates this year its 10th anniversary, and we have created this coalition on social investment with the with several partners. And what his conclusion is that pandemic and environmental degradation and climate change risks threaten people around the world. We've learned that because of the COVID-19 crisis. We are one people. We are one human community, and we face those risks together. And that it has become existential. It has become absolutely essential to support our global health commons, and they can increase our resilience to face these future shocks. But this will require adequate governance and investment frameworks. And we, as the public development community, we are gathered in the Finance in Common initiative, and we stand ready to help and take this effort to the next level. As Masood Ahmed has said, this is really a short window. We need to act now, and this is the role of development banks. This is the role of international financial institutions, of multilateral development banks, to really design the financial instruments that will allow to finance those commons for health, those fundamental functions that are in the area of information, surveillance, regulation, public health programs, taxes and subsidies. As mentioned, the fossil fuel subsidies as a very important action to remove them and to transform them in progressive fiscal instrument, progressive taxation, and the funding of those fundamental functions. And as was mentioned by several of you, you know what? This is cheap. This is actually these investments in data, in surveillance, in regulation, in public health institutions is a fraction of what the world is spending on health, which is 10% of global GDP. And we've seen this crisis. It has cost an incredible amount of the global resources to respond to this pandemic, and it's not over. The health expenditures have increased in all of the OECD countries, and the economy has suffered. We went through a massive global recession. So this investment is really, these costs dwarf the investments that are needed in institutions at national level, at regional level, at global level. These institutions, these public health institutions, this Center for Disease Control, these regulation agencies for medical products, for vaccines and medicines, supporting industrial policies for vaccine production. All of this we've seen has failed in 2020, and we need to invest more, and we need to invest now. Thank you very much. Thank you to all. And I really want to thank our partners, particularly the Center for Global Development, the Bruegel Institute, the IDFC, and the Coalition for Social Investment, and all our financial partners. And a very big thanks from our CEO, from Rémi Rioux, for this very, very important discussion, and for all of us to have participated. Thank you very much.
Thanks.
Thank you.